count me in, sir? Is that now live?
Yeah.
This is interesting. Good evening. Welcome to DidsburyFM. I'm sorry I brought my back to some people. Thank you for coming out on a wet Sunday evening to the last DidsburyFM of December because it's a really, really good one. I know many of you have been before, but there are some new people in the room. So I'll very quickly go through the format. Firstly, you're very welcome, the new people. I know one or two of you are here under duress, but you're free to leave. But I'm sure you won't leave. No pressure. And the format is, this is DidsburyFM, Didsbury Fabulous Mums and Dads. The idea is that we invite ordinary people who are doing extraordinary things. They're interviewed here with this audience. You have an opportunity to ask questions when I finish asking questions. And it's an informal occasion to have some exposure about some of the work people are doing in our communities and to connect us. And then subsequently we invite the same guests who come on All FM, 96.9 FM, where they're interviewed and we play music in between. So it's a little bit like Desert Island Discs, but it's much more informal. So you're all very welcome. Before we get going, we've got two fantastic guests this evening. Firstly, Professor Wynn, who will state his qualifications in a moment because they're too long for me to say all of them. But he is a stem cell specialist, haematologist. And then secondly, we've got one of the Lib Dem, Richard, who's in the audience, so he will then be here. So we've got a nice time this evening, not for it to be cut off or be too short. We always have a raffle, as some of you know, and the charity this evening, rightly in my view, is the Royal Manchester Children's Hospital, and so we ask you to donate generously. Our prizes, if I can just run through very quickly: Fiji Joe. I know people still don't take Fiji Joe's training, but it's going to be January and we ought to. Botanist, Food Sorcery, which is a baristery, and I know some people have been, others haven't been, but it's a really good prize. And Gusto, who have offered us. So those are 4 brilliant prizes. Sarah will come around and ask you to donate your cash into a box. It sounds a bit ominous, but I assure you it's not. And then that will be paid. And then, just before we start, I'm dressed like a Christmas tree for a specific reason. I'm doing something called Sally Sparkles, which is I wear an item of clothing which is sparkly all through December, and the money goes to the Oncology Royal Children's Manchester Hospital, to Christie, NSPCC and Save the Children. And Madeline is doing it as well, and Jack. Rob, my husband, is not doing it, but will be sponsoring it. So that's why I've got these fabulous trousers on, and please spread the word. So I think that's enough for me. Shall we get started? So, firstly, Rob, welcome.
Thank you very much.
Can you tell us who you are? You're Professor Wynn.
Yeah, so my name's Rob Wynn, and I'm a paediatrics or children's haematologist, which means I look after children with blood diseases, including leukemia, but also I run the bone marrow transplant unit at the Royal Manchester Children's Hospital, and we have a research interest in the development of stem cell therapies for children with leukemia, with children's blood cancer, but also for children with a variety of genetic illnesses, and even for children with non-genetic illness.
Interesting. Well, let's start a little from the beginning and then we'll end up there. Why medicine for you?
Well, it's a very good question. So I went to a school in Liverpool, and there was no medicine in the family. And in fact, my dad once said to me when I first said I wanted to do medicine that it was rather a grubby business, it was a trade, and that I should stay clear. I think he's changed his mind somewhat. But I enjoyed science at school, and when I went to sixth form, so I'd done my O-levels then, GCSEs as they are now, and it was the first day of a new term, and we all sat down, and the teacher said to us, "What are you going to do, lads?" And it was a boys' school in those days, the old 11 plus grammar school. He said, "What are you going to do, lads?" And my name is Wynn, so I'm W, and so I was the last of the group to be asked. So we went round the class saying, what are you going to do? And I remember very clearly, I have no idea what I want to do. But because it was a science class, a couple of the fellas said they want to do medicine. And I thought, as it got closer and closer, oh my God, do I want to do medicine? Do I want to do medicine? And then he said, Wynn, what do you want to do? And I said, I think, medicine, sir. And that really was it. So I had no clear notion that I was going to do medicine until that. Then I had the discussion with my dad about, hey, I'm going to be a doctor. And that was where, he was an economist, he was an academic. And that was where we had the conversation that it was a grubby specialty. And my elder brother is Professor of Philosophy at Oxford. And so he stayed in the non-grubby side of the world, and I got stuck in real life.
Well, I think saving the lives of children is not grubby in my opinion. We're very lucky to have you.
Thank you.
But particularly children, and then the specialism that you chose doesn't necessarily spring to mind straight away, does it? There are a few haematologists, and leukemia, cancer, malignancies are rife, and in young children. Was there a specific reason for that?
So it's a very good question, and I think all careers, I'm sure for everyone here, there's a little bit of serendipity in it, and I feel very privileged to be where I am and to do the job that I do every day. And I compare it with other people that do medicine, and I feel very lucky. I can't imagine being more fulfilled than I am in children's medicine and in haematology in particular. When I was a medical student, I did my clinical medicine in London. I started in Cambridge, went to London, and haematology was very well taught. There was a group of very dynamic, able, good teachers who were haematologists, looked after people with blood diseases, and I think that haematology brings together a number of aspects that are important in medicine, and which attracted me to it. First of all, it's a very clinical specialty, which is that we meet patients, we look after, they often have serious illnesses like leukemia, and we look after them for a very long period of time while we treat them. And so there is a very personal relationship between you, your patient, and your patient's family, and it's forged in the most intense of moments with serious illness and life and death. And that's fulfilling, it's challenging. As well as that, as haematologists, we work not just on the wards, but in the clinic and in the lab. And so, although we look after the patients, we also look at their blood down the microscope, and we make diagnosis. And there aren't many specialists that still do that. So if you go and see a chest physician, he or she might look after you clinically, but if there's a biopsy to be looked at, it'll be done by a pathologist. So in haematology, we do everything. It was very clear to me from the beginning and that it's a team specialty, and although the doctor is part of the team, he or she might lead the team, but actually the other people in the team are just as important. So, and in my children's team, there'll be, of course, nurses, very able specialist nurses, but also teachers, pharmacists, radiologists, x-ray people, everything. And so the success of our work depends on the functioning of that team. So we knew the patients, we made the diagnosis, we work in a team, and then often haematology is right at the cutting edge of medicine, and that it's very scientific, not because we're the cleverest doctors, but because if we think about cancer, when we do cancer in haematology, it's very easy to get a sample of the tumour of leukemia, just take a blood test. Easy to study, easy to do all the fancy stuff. Whereas if you've got a solid tumour, a breast cancer, brain tumour, it's much more difficult to get the tissue, and it's much more difficult to get enough. And so often the great advances in cancer medicine, in molecular biology and things have been made within haematology. And I think that's still true when we look at gene therapies and the stuff that we might talk about that's coming. Then I think then often haematology is at the lead of that. But whilst there is this fancy end of haematology, actually what we're doing every day is we're talking to customers in beds and their families. And then children. Well, I'm lucky for children. So I started off as an adult doctor, and when I say that London was good at teaching haematology, it was absolutely awful at teaching children, and I was scared of children. I was a young Liverpool lad. We're a small family, we didn't have lots of kids in it. I had no confidence with children, and so I was an adult doctor. And then I met my wife. By this time I'd moved to Newcastle. We both did adult medicine. We got together, but she was always going to do paediatrics, and so we moved to Edinburgh. So we went from London, well I was in London, she was in Newcastle, then we went to Edinburgh, and she switched to children's medicine, paediatric medicine in Edinburgh, and I did infectious diseases. I was going to do HIV or something, and but I was introduced to paediatrics through her. Because I did infectious diseases, we looked after some children, and I was introduced to the brilliance of paediatric medicine. And I then went back to haematology, and this time switched to children's haematology, and then came to Manchester to do just paediatric children's haematology, and then that was that. And when I look at children and haematology, what's so good about that? So I have all those wonderful things about haematology. I have the lab, I have the science, I have the kids now and their families, and as I get older, then the kids and their families and their parents keep us young. We all know how much we love our children, and it's such a privilege to be surrounded by young people every day. I'm sort of stuck at their adolescent level in many ways. We talk about football. I'm back to being a 17, 16-year-old kid in Liverpool.
I've seen your Twitter feed.
Yeah, and probably the worst thing in the world for me was to come back to the north of England, because when we were down south, I was just beginning to get out of football. But and also importantly, the kids get better. So the vast majority of children that we treat in transplants or in leukemia or with very serious blood diseases, the vast majority of kids that we look at, we cure, and that means they go on and live their life. And the long-term clinics where we see kids who we transplanted when they were 6 months and who are now, I've been a consultant 20 years, some of them are at university, some of them have got kids of their own. That is a very fulfilling job, and that's what I meant when I said that I couldn't imagine myself being as happy in any other specialty. But it came by accident to medicine, to haematology, to children, to children's haematology, and I'm forever grateful for each of those little steps that dragged me here.
I mentioned your Twitter feed because a lot of the families, your reputation professionally precedes you, but a lot of the families follow you and send you updates, or when the children are different stages of their lives. But you are a massive Liverpool fan, Liverpool Football Club fan, and so I'm asking now really to see, you are dealing with lots of children who don't make it. I've seen that, you've seen that. We know each other because you treated my son, who's still with us, Jack, and so you've probably seen our family at the worst part of our lives all round. But I wonder, how do you stay positive? What do you do for well-being when families are on the edge, where you've got to give news that's not nice, but the chances of success are poor when you're in ICU? And I just wondered, do you have a place? Is family really important to you? What do you do? I know you're not watching Liverpool all the time, but is that part of how you keep grounded?
Very good questions. So I think for the work, I think it is important that we remember that most kids get better. I worked in Toronto for a little while, and as I was leaving Toronto, actually to come back to be a consultant in Manchester, the fella said to me, remember the disease. And what he meant by that was, if we're looking after children and children die, then it is because of the disease that we have. And I think when we're talking to families, and much of my job is communication, it's about putting our treatment in the context of the disease. So we take risks with treatment, but we take risks with treatment because the disease is a serious disease. And I think that might help families, but it certainly helps me and my team to remember that the kids that we're looking after, they may be very sick. I've done a ward round today, I've seen 50 very sick children, but they're sick because of the illness that they have through no fault of theirs. This illness is something that they have, they brought their illness to us, and we can get most of those kids better. But we can't get all kids better, but that's because of the population that we have, is that we are looking after kids with very serious illness, leukemia and the like. And during those 25 years as a consultant, then I've seen vast improvements in outcome. So if we look at most children with leukemia will be cured now. So over 90% of the kids that I look after will be cured with chemotherapy alone, with simple treatment, simple to deliver, and with very few these days long-term side effects. So we return the kids to a life with normal school, normal puberty, normal fertility, normal life, normal intelligence. And where the disease does not respond is a minority, and it's becoming an even smaller minority. So I think the first way to survive personally is to realise that it's a privilege to do what you're doing, and I do realise that, and to remember the disease. And what I see every day is families like yours in the most difficult circumstances, with the most phenomenal resilience, who'd give everything, as you and Rob did to your children, even in busy professional lives, stop those lives, look after their children, and perhaps, and you can answer better than me, perhaps see something of life that I haven't seen actually, about what really matters in life, which is family. I mean, obviously I know that, but I don't know it in the way that many of these families know. What matters is family, what matters are our children, what matters are our children's welfare, and the welfare of all of those around us. Yeah, and within that, of course, what matters is that Liverpool are winning, and that this is a good season, that it looks like we might finally do it. And one of the kids actually, well, we transplant for Liverpool, so the kids from Liverpool come to us. So we always have lots of banter that the Liverpool kids are on the ward. And one of the kids asked me in clinic where my seat was at Anfield in the Cop, and actually came to find me at the during the half-time the other night. A very poorly child, but a child with great spirit and very great commitment to Liverpool. And she came in with her dad and family in the Cop, and she tweeted that. And I think the Twitter feed is, it's more of that banter between, informal banter between doctor and nurse, between patient and doctor. In paediatrics, these barriers, I don't know about adult medicine now, but in paediatrics, these barriers are long gone. And our business of inspiring confidence and trust in ourselves from families is built on those sort of conversations, as well as the serious conversations about how your kid is doing and where we're going. And in tweeting us, they do us great honour. You know, in coming from Liverpool to Manchester for our treatment, they do us honour that we know what we're doing. We're going to offer a treatment that can't be offered there. And when we bring kids from all, we have some fancy subspecialty interests in our transplant unit. And when kids come from Ireland and Newcastle and Kuwait and Italy for our treatment or whatever, that's good for us. It's good for Manchester. I couldn't imagine doing something different, and it's great that they come along, and I think part of that is Twitter feeds talking about football, getting to know everybody at every level, and you know, the Kuwaiti kids that arrived last week for the transplant, they're now following Liverpool Football Club, they're tweeting about Mo Salah, so we all get to know each other at all of these levels.
Can I ask you about some of the work? So stem cell, we've had Dr. Peter Arkwright here, immunologist, who you know. He was excellent and we learned a lot through him. One of the things that I'm very interested in, I think our audience are interested in, is there's a lot of work going on here in Manchester. We hear a lot about Great Ormond Street, great, but here at the Children's Hospital and the Christie, because of course you know your children radiotherapy, they go to Christie for various treatments, so another great hospital. But what are the specialisms that are going on here for STEM? Not just oncology, and your unit, because your unit has gone from 7 beds to 10.
11. Yeah, and there's lots of kids all over the hospital. We have too few beds for what we do.
Yeah. So I wonder if you could just share some of that, because Manchester is actually a groundbreaking place. I mean, it's not funded properly in my view, but that's a different discussion. Can you tell us a bit about what's happening in stem cell transplants?
Yeah, so this is at this end of the medicine, it's the fancy science, but it's for children and real children. So when and I think what's important is what we're doing with fancy stem cell transplants is built on experience of 20, 30 years, and we know why things work. So if you were my patient with leukemia and I was your transplant donor, then the way that I cure you is that my immune system, the immune system of the donor, attacks the cancer of the patient. And so we've known that for many, many years, for 50 years, bone marrow transplants, that we can use the immune system of a donor to cure leukemia that is otherwise incurable. And that's a bone marrow transplant. Our patient receives the bone marrow from a different person, and the bone marrow makes an immune system that kills the leukemia. So we've known that for a long time, but we also know that we take risk with that. So that when we do a transplant, my immune system might get rid of your leukemia, but it might also get rid of you and just reject the whole of you. And so the first bit of fancy medicine that we're doing in Manchester is that instead of using my immune system to attack your leukemia, we take the patient's own immune system, we put a gene in it using gene therapy, and we redirect their own immune system against their cancer. And that works in the same way as this worked, but there's no risk of it killing the rest of the body because it's come from there. So that's fancy gene therapy of cancer, and we're just beginning on that road, and I think there's a long future, and what we need to do is to treat the kids that currently don't respond to treatment, which is more like the kids with brain tumours and things like that. The leukemia kids do a bit better anyway. So that's the first thing. But we are refining our immune therapy of cancer, and I hope that we'll open trials in Manchester to further that and in non-leukemia cancers. When we come to stem cells, so stem cells, what a stem cell is it makes cells forever. So you can have a stem cell, a blood stem cell that will make all types of blood forever. You could have a neural stem cell that will make brain, and you can have types of stem cell that will make all tissue. Our stem cell work is mainly in blood stem cells, and if we've got a child with a genetic disease of the blood, so a common one might be something called sickle cell anemia, where the child can't make blood, red blood cells, and life is limited, and it's a difficult illness to have. The illness is all in the red blood cell, and it's actually all because of a single gene mistake. So again, Sally, if you had sickle cell anemia, I can transplant you, and my bone marrow, which doesn't have sickle cell anemia, when it's working in you, means you don't have it anymore. But there's some risk of that, because my bone marrow must be matched to you, and my bone marrow can cause problems in your body rejection and the like. But actually, the only reason we do a bone marrow transplant is because my bone marrow hasn't got the bad gene. So what we're doing, we take out the patient's bone marrow and the stem cells within it, we genetically correct it, and then we do a bone marrow transplant using their own genetically corrected cells, so that the new bone marrow, even though it's from that patient, is genetically corrected and they don't have the disease. And that's stem cell gene therapy, and I think we're a leading centre in the world for that. We have our own trials that are open. We collaborate with Great Ormond Street. There are only us and them in this country, and not many others in Europe.